Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Onwoka. Here are some of the highlights this hour. Today, Presidential Task Force visits Kano State over worries of unexplained deaths. Keeping the frontline safe and insured on our theme this evening. And huge political rallies in Burundi spark fears of coronavirus jump. The National Health Insurance Scheme, NHIS, was established by an act in 2004, and the scheme is aimed at providing easy access to healthcare for all Nigerians. In the wake of COVID-19, frontline medical officers are much more exposed to the dangers of infection, especially those who work at isolation centers, and the federal government, in a bid to stemming the impact of such exposure, is coming up with an insurance scheme. But how far can this be sustained? Ensuring the health worker is our theme this evening. And we have the former NHIS boss, Professor Usman Yusuf, joining us later on the program. Now let's go to the total confirmed cases of COVID-19 in the country at 1,337. The death toll remains at 40, while 255 persons have been discharged. On a state-by-state breakdown, Lagos remains the epicenter of the pandemic with 764 cases, followed by the FCT with 157 cases. And Kano, the epicenter in the northern region, has 77 cases, Borno 41, Gombe 37, Ogun 35, Osun 34, Katsina at 30 cases, Edo has 25, followed by Oyo 21, Kaduna has 15, followed by Bauchi 14, Akwa Ibom is next with 12 cases, Kwara at 11, Sokoto 10, Ekiti 8, Ondo as well, Taraba 8 cases each, Delta, Rivers, Abia. Delta and Rivers have 6 cases each, while Abia, Enugu, Niger and Jigawa, also Zamfara, have 2 cases, and the other cases have, the other states rather, have 1 cases each, as you can see. The Presidential Task Force delegation on COVID-19 is visiting Kano State following the marching order given to them by the President to reinforce and identify areas of federal government interventions. Now, according to the leader of the delegation, Dr. Nasarawa, the increasing number of deaths in Kano is becoming a source of concern, and finding a lasting solution is needed in the wake of fighting a pandemic. At the meeting with the Kano response team, the governor, Abdullahi Ganduje, expressed relief with the swift response of the federal government.
If you don't have a functional testing center like now, which is completely down for almost 1 week now, you find that to continue other processes is immaterial, because you cannot move forward. You cannot take sample which you cannot treat. You take sample which you send to Abuja. Abuja, from here to Abuja is 7 hours, and the road is under construction. Some of the samples can get spoiled, and by the time you reach Abuja, there was even a time when the samples were bad. Our staff, they have to come back to Kano. They have to start all over.
From instructions from Mr. President, went ahead to mobilize additional support by reaching out to development partners. Sir, we are here to support the team. We promise you we are not reinventing the wheel, because the wheel has already been established. We are only to reinforce it and to make sure that there is synergy.
Now, it is clear that health workers need support to adequately attend to patients who are COVID-19 positive to protect themselves and also prevent a spread. The federal government has promised improved welfare of the frontline workers by signing a memorandum of understanding on the provision of hazard allowances and other incentives with key health sector professional associations. But how far does the insurance cover go? How sustainable is it? Joining us on the program is Professor Usman Yusuf, a medical practitioner and former NHIS boss. He joins us from our Abuja studio. We'd like to thank you, Prof, for joining us at this time. I must begin by asking you that before COVID-19, what was the policy for the Nigerian healthcare worker?
Very much, Millicent. So, COVID-19 essentially is testing three things of all the healthcares of nations across the world. Number one, the quality of the healthcare, the standard of governance, and the human capital. This is not something you can build in a day or years. And if any of these tripods is weak, it will be shown on massively. And this exactly in developing countries, where the quality of our healthcare system is weak, governance has been a problem, and our capital investment has been very low. We will suffer a great deal. And that is why the emphasis has been on prevention, prevention, prevention. This is where we are today. And that's why you hear me particularly raising voices, because I know what we have, I know what we can do, I know what we cannot do. The United States, in spite of all its economic prowess, is suffering the ravages of this virus. And then here we are. We must do the right thing. The right thing is understand that we are at war with an unseen enemy. And we must bring the fierce urgency of now that I honestly do not see. I have seen the numbers you've put on the screen, and I contest them. Lagos is not the epicenter of COVID-19. Kano is. Mortality is very high. We are not testing, that's why we are not seeing. WHO say the key to control is testing, testing, testing. And any map in the world that you do not see COVID-19, it is not because it's not there, it's an indication of lack of testing. So, we have a huge problem that we must address. Testing, testing, testing. Because that's the only way we can identify the patient. First of all, we've done what the right thing is. Initially, we seal the borders to prevent importation of cases. Then secondly, you will do what is called hard containment. That is testing, isolating positive cases, treat if you need to reduce mortality, do contact tracing. If you do not test, how can you find out? There are more cases in Kano than anywhere else in this country put together. People are dying. The way we can control this disease is be honest with ourselves that we have a limitation of testing. I mean, if we do not test, we will not see. People will continue to die.
The NCDC has admitted that much, Professor. But I would like us to talk about ensuring the healthcare worker. You listen to the president talk about signing an MOU on the provision of hazard allowances, and then, insurance policy generally for, these people who are on the front line. What is the policy before now? And do you think that, the provision of this hazard allowance is enough?
I don't know, to be honest, I don't know what the policy is. The Minister of Health will be the one to tell you that. I mean, where I've worked in the world, outside the world, you have life insurance, but I don't know what it is here. And the real issue is we have lost doctors and nurses to Lassa fever before. And their families have just gone, they've lost a loved one. In Aminu Kano Teaching Hospital, they lost 2 doctors, a very young house officer and a consultant. They operated on a patient and they died of Lassa fever. They were not covered. Now we have this pandemic that all over the world, the people in the front line are doctors and nurses and receptionists at the clinics. They are exposed to the highest doses of this lethal organism, and they succumb. I have a doctor friend, a professor who is laying in Kano, and the story is all over. The chief medical director of UCH also came down with it. And there are many doctors, especially our young doctors, who are in the front line. They are exposed to this, and the nurses that are at the bedside of patients. So it's a good thing the president is considering them and giving life insurance and increasing their hazard allowance, which is good. They fought the right battle. What I want them, and I told NMA and resident doctors, their real fight should be protecting them when they go to war. No soldier will go to Sambisa forest without a gun. So also, no matter how much life insurance or no matter how much hazard allowance you're given, if you do not have personal protective equipment, you are a sitting duck for this virus. You are exposing yourself. And WHO has said it clearly. It is the right of doctors, for every employer, every government, to protect doctors before they see patients. What's happening in Kano is this. Private hospitals are closing because they do not have PPEs and they are not equipped to take care of patients who have COVID-19. You take this patient to government hospitals do not have PPE. So doctors are not going to expose themselves and kill themselves. They have to protect themselves and protect their families and protect other patients. So governments all over this country need to provide personal protective equipment for doctors very urgently. It's not something that will wait. The president has said it should be done. We don't want to wait till tomorrow. Our
We appreciate your time,
exposed,
Professor.
And they are in the front line. Yeah.
Many thanks, Professor Usman Yusuf, medical practitioner, former NHIS boss. Thank you for joining us on the program.
I thank you very much too, Millicent.
Now, lawmakers at the National Assembly resumed plenary today after 5 weeks of recess, while welcoming colleagues and acknowledging that the pandemic has affected the 2020 budget. The President of Senate said plenary was resuming to help with sustaining solutions to the health crisis as a result of the pandemic. In reflection of present realities, the Senate leader moved a motion to suspend Order 11 of the House rules to enable senators speak from seats not belonging to them to enable them comply with social distancing. There was consideration of a motion to review the national response to COVID-19 and the way forward. And the motion sponsored by the majority and minority leaders, they say they are concerned about the social and economic impact of the lockdown. The senators also note that the lockdown is ineffective because of poor awareness of Nigerians about the dangers of COVID-19 and inefficiencies in the distribution of palliatives. Also in the House of Representatives, the Speaker, Mr. Femi Gbajabiamila, asked the federal government to use federal lawmakers to distribute palliatives. The lawmakers in the Green Chamber also looked at passing a second economic stimulus bill while asking the Senate to pass the first economic stimulus bill. Nasarawa State has recorded its first confirmed case of COVID-19. The state governor, Abdullahi Sule, made the announcement today at the government house in Lafia, the state capital. He said the index case is a young lady who is now in isolation at the Dalhatu Arab Specialist Hospital in the state capital and came in from Kano State last week despite restrictions in both states.
For the first time, we had a lady that tested in Kokwana, and she's positive. The lady actually traveled from Kano to come to Kokwana, and she was tested. And after the test, it came out that she is positive. So it is sad for you to announce that Nasarawa has his first case of a positive case from this lady that traveled from Kano to Kokwana. We have already evacuated the lady from Kokwana to Lafia, where we have better facilities to take care of her. We have also isolated the family home where she came from, so that we can conduct the proper test, and ensure that none of the other members of the families is actually infected.
So to come on our COVID-19 updates, we have more medical practitioners on the global impact of the coronavirus. Please stay with us. Welcome back to the program. Now, the Delta State governor has expressed optimism as to the gains of the lockdown measures to curbing COVID-19 in the state. In a broadcast message by Governor Ifeanyi Okowa, the period of the lockdown is a leeway to easily trace, identify, isolate and test infected persons. The governor said the measures will be eased in a sensible approach so as not to wipe out the gains of the past weeks. He also announced that the partial ban on movement within the state has been lifted effective Thursday, 30th April 2020, with business activities restricted between 6 a.m. and 7 p.m., among other restrictions. He added that security agencies will be on hand to ensure strict compliance of the order. Now, joining us for more on limiting the spread of COVID-19 is Dr. Iyala Douglas-Pepper, is the GP Registrar, Queen Elizabeth Hospital, Norfolk in England. And also in our Lagos studio, we have Dr. Aderinshola Anifowose, a public health physician. Welcome you both to the program.
Thank you, Millicent.
All right, let's start with Doctor in Lagos, and that is what we've heard, community transmission that is permeating right now. We heard the Minister of Health today say that the lockdown resort has been limiting, or rather the gains of the lockdown results has been limited. He said there are stronger signs of community spreading, even though we're evidence showing there is evidence of improved testing. So how do you say that, we're having more cases, we're having more transmissions, and then we're going to ease restrictions?
Okay, thank you so much for having me here. We need to ease off the lockdown as soon as possible. And I think I agree totally with the government on this. It's having to choose between the devil and the deep blue sea. So right now they've taken the decision which is in the best interest of the community, the people which they serve, and I think I totally agree with it.
The SGF as well talked about saying that the danger hasn't passed, but how are you certain that Nigerians are disciplined enough to wear their masks, to wash their hands as much as possible and take all the other sanitary precautions from getting COVID-19?
Thank you for that question. And the basic thing will still be to increase more on the risk communication than community engagement. When I talk about risk communication and community engagement, talking about bottom-up approach, start from the people, go to the community leaders, the religious leaders. They have to understand the risk involved in this. This is a warfare, and the battle we're fighting, we have to win. And the way we have to win it is by adhering to the strict precautions and the protocols already laid, which are the social distancing, regular hand washing, and then avoid gathering as much as possible. All those things we've always known, not to touch your face with your hands, not to touch your nose or your mouth, and as much as possible to avoid crowd gathering at this point in time.
Let's go to Dr. Douglas-Pepper in Norfolk in England. You've talked about a method called shielding. We hear that from certain persons in the UK, patients who might have underlying illness, that shielding is a process that protects them this period. Can you explain a little further how that works in the UK?
All right, thank you very much. So basically, I'm sure the very popular concept is that of self-isolation, where if you are suspected to have symptoms of COVID-19, you self-isolate for 14 days or thereabouts. But there are people who are very, very high risk and very vulnerable people. So these are people that the concept of shielding will come into play. Hello, can you hear me?
Yes. Go ahead.
All right. So for shielding, basically, it's if for people who have very underlying chronic medical problems, people who have certain types of cancers, lymphomas, leukemias, the very vulnerable ones, people who are on organ transplant, people who have advanced form of diabetes, and people who have advanced form of chronic kidney disease as well. So these people, what happens basically is that they are asked to shield, which is self-isolating for about 12 weeks. If you remember, there was a time when the government asked for volunteers to help with the NHS. So these volunteers, basically, their job is to attend to these people who are shielding. They can apply for grants from the government to cater for their needs, and the volunteers help to provide their basic needs to them, so they are protected from the influence of the external society.
Tell us your thoughts about what has been termed herd immunity as an option to fighting the coronavirus.
Herd immunity is actually a concept that was looked at initially by the UK to use as a means of combating and curbing and fighting coronavirus, which causes COVID-19. But I think the government at the time felt they were wrongly advised. So herd immunity is when a large number of people in a particular place develop are infected or contract a virus or a bacteria, a germ or a disease or whatever, and they recover, they kind of develop immunity to that particular condition. So if, let's say, 50 to 70% of a population gets infected by a virus or a disease and they develop immunity, they kind of protect the entire community. So you have fewer people who are at high risk and more people who have been protected. So they kind of help to shield the entire population. Now, when we talk about herd immunity, there are two basic ways where this can be achieved. One is, like I said earlier, those who get infected, recover, they develop antibodies and memory cells against that particular condition, and also the process of vaccination. What happens with vaccination, if you know anything about vaccination, is that vaccines contain tiny amount of the organism that causes the disease, all right, which is what we call the antigens. The body itself contains antibodies. So when the vaccine is injected into you, for instance, the body responds by developing specific antibodies to fight against this offending organism that it has detected, which is the vaccine. And in doing that, it fights against the disease and also develops an immunity, so that in the future, if that kind of organism comes into the body, it remembers that, oh, I've fought this before, and it develops that response against it. So that is one of the measures also that herd immunity can be developed.
Thanks for that explanation, but we appreciate your time, Dr. Iyala Douglas-Pepple, GP Registrar, Norfolk Hospital. Thank you for joining us on the program.
Thank you very much.
And finally to you, Dr. Anifowoshe, the NCDC has talked about testing 22 million people in 3 months. Do you think we can achieve that? He says it's an ambitious target, but then they're gearing up for that.
Yeah, thank you. It's possible to achieve that. We have to be optimistic, and we have to have the right attitude to it, because we need to test as much as possible, test and test and test, such that we can isolate the cases and then do contact tracing and treat as much as possible, such that we break the chain of the disease infection, disease transmission, and as much as possible flatten the curve.
All right, we appreciate your time, Dr. Aderishola Anifowoshe, public health physician. Thank you for joining us on the program.
Thank you so much for having me.
And finally, images of thousands of people mingling at political rallies in Burundi on sparked concerns that coronavirus infections could soar. Olivier Manzi, a specialist in infectious diseases, says large gatherings of this nature risk accelerating the spread of the virus. And so we have the NCDC working closely with states. You can find the latest national strategies to curbing the pandemic on their website. Also, the World Health Organization, each moment, regular updates as to strategies, national, subnational levels, and practical guidance for strategic action tailored to local context. Well, that's our COVID-19 edition on today. Thank you for watching. Another update comes your way again at 9 p.m. I'm Millicent Wonwaka. Bye for now and stay safe.